from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Welcome back to Good Morning Arkansas. We're happy to have Dr. Morgan Sauer with Baptist Health back in the studio this morning, and today we're talking Legionnaires Disease. This is something maybe people don't know a whole lot about. We've heard it in the media, we've heard about it on the news, but let's explain for people what it is.
So recently there was an outbreak of Legionnaires in a hotel in Atlanta, and people will get really afraid of this and talk about this. The good news is with Legionnaires disease that really, if you get exposed, you have less than a 5% chance of getting Legionnaires disease. Legionnaires disease itself is a type of pneumonia, so people think it's something horrible that ravages the whole body. It actually is a pneumonia, and typically it has pneumonia type symptoms, but about a third to half people will have gastrointestinal symptoms like diarrhea, and a third of people will actually have neurologic symptoms where they get confused. Good news is it doesn't usually go after children. It's middle-aged and older adults and people who have weakened lung systems like from smoking, COPD, or other pulmonary illness, or if they have other forms of immunocompromisation, where their immune system just doesn't work quite as well.
And so with those symptoms, could those be associated with other things? Is this hard to diagnose, or when someone walks in with it, do you typically know what it is?
Well, there's only about 8,000 to 18,000 cases in the U.S. per year, so it's not something we diagnose on a regular basis. Most of the time, this is probably diagnosed as regular pneumonia, and thank goodness that most of the antibiotics that we use for regular community-acquired pneumonia will actually cover Legionnaires disease. Generic, oral, work great.
Oh, that's awesome.
Absolutely. Go ahead.
Oh, you were saying it's not something that you guys diagnose that often, but then you hear about the cases like you were just talking in Georgia that happen. So why is that something that happens?
So why Legionnaires occurs is the bacteria actually likes to live in warm water, really about 68 degrees Fahrenheit to 122 degrees Fahrenheit. Anything above 140 will kill it. And so this bacteria likes to hang out in water systems that are used in large buildings. So think about large office spaces, hotels, and it hangs out there. It can also live in like shower heads too.
Oh, interesting.
And so when this comes out and the water gets aerosolized, a nice steamy shower, you breathe it in, and that's where you can get the Legionnaires pneumonia or the Legionnaires disease.
I would never have even thought that was one of the ways you could contract an illness. That's so interesting. So let's say that someone was staying at that hotel in Georgia, and then they travel home and then they start experiencing symptoms. What do you suggest that they do?
So usually symptoms are going to appear about 2 to 10 days after you get exposed. If that happens, definitely go to your doctor and mention, hey, I've had some travel. I've stayed at a convention center, or I've stayed at a hotel like this. This is not actually diagnosed by blood. The easiest way to diagnose is by urine test. Urine test is quick, turns around within a day. Also, you can have sometimes people either cough up some phlegm and you can test that, or even take a camera and go down and get some into the lungs. That's really pretty much safe people only who are in the hospital because it's invasive. So the urine test will work fine, and using, again, the common generic oral antibiotics without having to get an IV, not having to go into the hospital.
Yeah, and you were saying this is typically for middle-aged people are the ones that get this, but is this something that a child could contract, and then would that be more dangerous for someone?
A child could contract this. Typically it's middle-aged and seniors. Actually, it even skews more into the senior realm. Children, especially if they're immunocompromised from having to take steroids or other types of illnesses that are not real common, they could be at risk. But mostly it's going to be summer and fall. It's going to be your people 50 and above.
So now I guess the question is, how can this be prevented?
So fortunately, there are monitoring programs, and all monitoring programs, you do the best you can, but sometimes something will slip through the cracks. That's just part of life, and we can't live life in a bubble. So hotels and convention centers work very diligently to make sure that their systems are tested and their systems are cleaned on a routine basis. If you've had work done at home, make sure there aren't any pipes, water pipes that have dead ends, because that water can become stagnant. It just kind of sits there instead of getting flushed out. Again, you can turn the temperature up, but there's a risk with that. If you turn the water heater up, you can clean the pipes out with it. However, that's where you get a risk for burns. And so you hear about kids going in the bathtub and turning the water and scalding themselves. So you don't, if you're going to do that, you might do it temporarily, but you don't want to do it long term.
Yeah, you don't want to leave that on, and then maybe when you're giving your kid a bath, something worse can happen. So
absolutely, or an Alzheimer's patient who doesn't recognize it and turns the water on and burns himself. So most of the time, again, very few people are actually going to contract it once exposed. So just be aware and talk to your doctor.
I guess that is a good thing to know. Just because you're exposed to it doesn't necessarily mean only 5%, like you said, 5% are going to actually end up with Legionnaires' disease.
5% or less.
Okay, that's interesting. Let's go over the symptoms one more time for people out there, just so they know what to look out for.
So your classic pneumonia symptoms will be present. So cough, either a wet cough, maybe a dry cough, fever, just a little bit of shortness of breath. But the ones that really start to differentiate Legionnaires are when you start to get, if you have diarrhea. If you begin to have neurologic symptoms, which can be difficulty with coordination. So you may have some difficulty walking, you may have some difficulty riding, or you start to become confused, just kind of dopey, you're just not your normal self. And that is a good reason when you go to your doctor, get your normal pneumonia workup, but also just go ahead and get a quick urine test too.
Well, Dr. Sauer, for us, we appreciate you so much. If you have questions, you can reach out to Baptist Health with those, and we appreciate you so much for being here with us today.